One of the most common questions I get asked by my patients with spinal stenosis is, do I need a spinal fusion? Spinal stenosis is a condition where the nerves in the lower back or the lumbar spine get pinched due to a combination of bone spurs, arthritis, and degenerated tissues. Because of this, the patients can develop severe low back pain radiating all the way down into the legs with numbness and tingling. Spinal fusion is a surgery where rods and screws are placed into the spine to stabilize the vertebrae. Today I'm going to show you why some patients with spinal stenosis need a fusion, but the others don't. I'm going to do this by showing you two cases of spinal stenosis, patients who had very similar symptoms. One of these patients needed to have a fusion and the other one did not. There are some very subtle differences in the MRI, which let you decide if the patient needs to have a fusion or not. Let's talk about that today. So this first patient was having severe low back pain radiating down the legs, which is a classic sign of spinal stenosis. Here's the MRI. This is a side view of the lumbar spine or the lower back. This is the front of the body, and this is the back of the body. These boxes are the bones, called the vertebrae. Between the vertebrae are the cushions, called the discs. Behind the vertebrae and the discs is this long tube called the spinal canal. This is full of spinal fluid, which appears white on the MRI. Within the spinal fluid are the nerves, which appear like long strings running up and down the spinal canal. At a normal level, like right here between L3 and L4, the spinal canal is wide open, which is outlined in yellow. If you were to slice the spine across like this and turn it over and look at the cross-section, the spinal canal would look like this, completely wide open. Similarly, the canal is wide open between L5 and S1. But over here between L4 and L5, you can see that there is a clear problem. The spinal canal is almost completely pinched off. This is happening for two reasons. First, the disc is degenerating and pouching out, pushing on the nerves from the front. Second, the joints between L4 and L5 vertebrae, called the facet joints, these joints are degenerating, forming bone spurs and degenerated tissue called ligamentum flavum. Because the joints have overgrown so much, the nerves are getting squeezed from the back also. Due to a combination of these two problems, the spinal canal is getting squeezed between them like a choke point. This is what spinal stenosis looks like on MRI. The surgery to fix this problem is called a laminectomy. Laminectomy involves removing this part of the bone, the facet joints, with a goal of opening up the spinal canal to its normal caliber so that you go from here to here. In order to open up the canal, you have to remove parts of the facet joints, which I'm outlining right here. By removing this degenerated tissue, you're opening up the spinal canal and freeing up the nerves. Now, this is the most important point. This patient does not need a spinal fusion because less than half of the facet joints are being removed. Studies have shown that if less than half of the facet joint is removed during laminectomy, in the vast majority of cases, the spine will remain stable. This is the key point to understand. So this is a patient who underwent a L4, L5 laminectomy surgery without fusion and had an excellent outcome. Now, let me show you a case of a second patient with spinal stenosis who needed a fusion in addition to the laminectomy. Let's take a look at the MRI. Just like the first patient, this patient also had severe spinal stenosis between L4 and L5. The MRIs look very similar, but have very important subtle differences. The caliber of the spinal canal at L3-4 here and at L5-S1 here is normal. In comparison, the spinal canal at L4-5 has been squeezed down to almost nothing due to a combination of a bulging disc and a severely arthritic and overgrown facet joint. The normal dimensions of the spinal canal at L4-5 should be something like this, which means that we need to remove at least this much of the facet joints, well over 50%. And when you remove more than 50% of facet joints, well, the spine will become unstable. And if you don't fuse it, it will slip over time, a condition called spondylolisthesis. Obviously, this is something you want to avoid because then you're going to need a second spine surgery down the road. To prevent this from happening after completing the laminectomy, I performed a L4-5 fusion with rods, screws, and a cage. The patient did extremely well. The severe low back pain radiating down the leg resolved completely. So I hope now you have a better idea why sometimes surgeons will recommend laminectomy with a fusion And at other times, they will recommend a laminectomy without a fusion for spinal stenosis. Don't forget to subscribe to my channel. Thank you for watching and see you next time.